Hello and welcome back to the final day of the Wellbeing Moment. I hope you have enjoyed and shared all the information that I've had on the Wellbeing Moment this week as it relates to your man's health and the men in your life. I hope you will come back and frequently revisit these topics because it does contain a wealth of information. Today I'm going to deal with the final topic in this week, and that is men's sexual health. I think it's very important to discuss this because a lot of times, as a clinician, I have found that men are not open to being on medications for any ailment because they sense it will interfere with their sexual health. So let's talk about that. Um, Maybe one of the most common areas when it comes to sexual health and medications is hypertension. And hypertension is a very common condition, especially in people over the age of 50. It actually begins to increase exponentially over the age of 50 and is higher in African American and non-Black Hispanic descent. And a lot of times, in my experience, I've found that a man may not be willing to take his blood pressure medications because he's concerned about how it will impact his sexual health, his sexual function. And so I invite you to have an open dialogue with your doctor about these kind of topics because the myth that all medications may affect your sexual health is not necessarily true. And only by your doctor knowing that is affecting your sexual function can he or she make a change. Just keep in mind that there's very little that your physician probably has not already heard already. And so you shouldn't feel shy or embarrassed or just stop taking your medications because you don't want to have that discussion. If you are a man who is affected by sexual dysfunction not related to any medications or not being on any medications, this certainly is a time to seek um, advice from a physician. Have a physical exam. There may be some physical causes as to why you're having sexual dysfunction. And the only way that you can know that, or we can know that, is by having a complete annual physical, which is what I discussed in an earlier segment. There is help for sexual dysfunction. As you are well aware, there are several medications on the market. If one does not help, I encourage you to go take a look at another or ask your physician to prescribe another. But more importantly, if you are having sexual dysfunction, it's time to speak to a urologist. A urologist is a specialist in male health, and particularly as it relates to the prostate and the genital organs. And so you may want to have a discussion with a urologist. I kind of am shying away from you just going with some over-the-counter stuff, like, like over-the-counter Viagra stuff, because you really don't know what's contained in that. I know there's lots of radio adverts out about, male enhancement medications. Please check with your healthcare provider, especially if you have a medical condition such as diabetes or hypertension, before you use those male enhancement techniques or medications. Um, there are some other causes of male erectile dysfunction or sexual dysfunction. One of them that is not really spoken about a lot is depression, psychological disorders such as depression. So the only way to unmask this, obviously, is speaking to your healthcare provider and maybe even undergoing a depression screen. Stress also plays a huge role, especially if it's work related, familial stress, relationship stress. You may want to speak to a therapist. And again, I'm going to emphasize here, there's nothing wrong with therapy. And so, especially if you're from the African American community and there's kind of a stigma, you don't want to talk to anybody, this may be the best thing that happens to you, because really, sexual health is integrally related to your psychological health. And if there's a block there, inevitably it may affect your sexual health. So go ahead, and if you're feeling sad, if you're having symptoms of depression, you may want to have your primary care physician screen you for depression symptoms rather than just putting you on medications. Another very important thing to consider when it comes to your sexual health is intimacy and also sexually transmitted diseases. There is an epidemic of HIV. It still is present in our society. And I want to encourage safe sex if you are not in a monogamous relationship. We still have several sexually transmitted diseases out there, and I encourage you to get screened. If you're a man having sex with several partners, a man having sex with other men, or a man having sex with both sexes. So please, we need to open up the dialogue about HIV and how it's spread. We want to reduce this disease from taking young people away, because most times if you're having unsafe sex and you don't even know your HIV status, then you're probably spreading this virus. And that's just not something that should occur in the 21st century. So this is just a little snippet about sexual health. I felt this was probably the best time to discuss it, especially on the verge of a weekend. If you are following this in sequence, go ahead and have an open discussion about sexual health with your partner and the things that you need to do. And if you need to see a healthcare provider, go ahead and schedule that appointment. Have a great, great weekend, everybody. Here's to your health and well-being. Be well. Dr. Anno signing off. Goodbye.